Pop quiz number 18. When you're developing the plan of care for a home health client who has been discharged after a radical prostatectomy, which activities would you delegate to the home health aide? Select all that apply. All right, guys, how do we treat select all that apply? As true or false? Let's go. 1. Monitoring the client for symptoms of urinary infection. False. The home health aide has not been trained. They are not licensed. They are not educated to know those signs and symptoms of infection. And let me be careful. When I say they're not educated, I don't mean they're not smart. What I mean is they have not been taught those signs and symptoms of infection to recognize for their license. Okay? So false. That would be an LPN or an RN. That would not be delegated to a home health aide. Choice 2, helping the client to connect the catheter to the leg bag. True. I know what you're thinking, Professor D, that's a catheter. We're not asking them to connect it to the patient. It's already in the patient, right? Just that catheter end to the bag. That home health aide is not doing anything that is requiring the critical thinking skills that the LPN or the RN would have to use for the patient. So they absolutely can do that. Now, if the question said, inserting the catheter into the patient, then we would say no, because the home health aide would not be able to do that. But for choice number 2, we're going to keep it. Yes. 3, checking the client's incision for appropriate wound healing. False. They have not been trained to recognize if this wound is healing appropriately, if it's infected, none of that. That would be an LPN or RN, but not a home health aide. False. Choice 4, assisting the client to ambulate for increasing distances. True. Home health aides, unlicensed assistive personnel, that's what I mean when I say UAPs, by the way. They can do lots of things. They can take vitals. They can record and report. They can do flow sheets. They can ambulate the patient, unless it's a first-time ambulation with a deficiency such as a stroke. They can feed patients, unless it's the first feeding with a deficiency such as possible dysphagia, where they can aspirate like a stroke. That would be the RN. But they can do ADLs. They can help the patient brush their teeth. There are lots of things that they can do. But when you guys are testing and you're trying to figure out, okay, can they do it or can't they? Just think of critical thinking. If it requires critical thinking skills, it has to go to the LPN or the RN, depending on the situation, okay? Last, choice 5, helping the client shower at least every other day. Yes, that's part of the ADLs, bathing, getting dressed, combing their hair, brushing their teeth. Absolutely, they can do that.